good afternoon again. A brief introduction. Feel free, first of all, to ask your questions anytime you want to. There's no problem with that. You can interrupt. Don't feel actually like you're interrupting. We're just making a conversation. My part tonight is to give you a little bit about the international perspective, just somebody else's perspective, basically, from another country, about what's happening here in Ireland. And just to give you a little bit of more of a background, I am an orthopedic surgeon. I'm practicing here at the west of Ireland the last 2 years. I just came off of my fellowships and we moved back to Ireland, but I'm a trainee from Ireland. I studied medicine in Ireland, so I've been in Ireland about 20 years now. Prior to that, I was in Charleston, South Carolina, and I'm a graduate of College of Charleston, where I did my basic biochemistry degree and all this. There we go. We have the first interruption, and my apology for that is my little daughter. Both of them are up. Amy, sorry, Jason, 1 second. Amy, they're both downstairs up here. Do you mind? Could you come down? Girls, you okay? All right, sorry about it, sorry. I'll actually transfer upstairs. It won't work here by me being downstairs, my apologies. So yeah, thank you, Amy. Sorry about this. So basically, as an orthopedic surgeon, you know that with COVID virus at the moment, but I want to tell you a little bit about what's happening in Ireland in general. Like pretty much, we have restrictions, and our lives obviously have changed since this disease arrived in Europe, this virus, and like all the other countries, we had successive increase in the restrictions, which means every other week or every 2 weeks or so, new restrictions came into place, and they escalated basically to the point that, you know, we started with schools being closed, then the shops, the general shops, and then the only essential shops have of late stayed open now, and they're allowed to stay open. We had restriction in our movement, meaning try not to leave the house, and essentially not live. That's about it. So the idea is being that we're doing this social distancing, what we call it, and everybody knows now. We're trying to stay a little bit apart because we want to halt the spread of the virus. And that's very important because, as you know, there's a geometric increase initially when an epidemic happens, and that's what we're trying to do. We call it flatten the curve. So this geometric increase in cases has to stop. As an orthopedic surgeon, I go to my work, I used to go to my work because I used to do a lot of elective surgery. Now all the elective surgery has come to a halt, and we only provide essential services. The reason being is because we're trying to do our part by staying out of the way of the people that they are in the very front line, which are the respiratory doctors usually and the anesthetists, to make space for them to do their work. So we had to cut down to our services as much as we can, while at the same time maintaining an appropriate level of care for the people that, you know, injure themselves every day. So we provide trauma care as needed, but to the point that it's safe, and at the same time only essential or only required to be. You realize now that a lot of people, due to the restrictions, they're not traveling a lot. So that means there is not as many sports injuries. There is not as many high velocity injuries because people are not on the highways and on the roads all the time. Just to give you a little bit of a perspective also of Ireland and what are we talking about. Ireland is the size of, it's about 5 million people altogether. It's the least densely populated country in Europe, which is good. Having said that, we have our big centers and our big cities. So Dublin on the East Coast has about 1.5 million of people. And then there's another 2 or 3 bigger cities like Galway, which is in the West Coast, Waterford, which is in the South, and Cork, which is in the Southwest. So the idea basically is that we provide trauma care every day as the cases come in, and we try to do it in an organized way as much as we can, despite the fact that we had to reconfigure all of our services. So for example, in the hospital, we have designated hospital where some of them are designated to receive the COVID patients. and others are designated to receive the non-COVID patients, meaning the services, the rest of the services that are non-COVID related, to bring them to the non-COVID hospital and try to get them in and out as soon as possible safely, so they don't obviously clutter the system and they don't themselves put themselves. So the idea is that we see them in our hospital, which is down the road, a different hospital, obviously, from the one that's the COVID related. And when they come in, they have to have a test. And this test has to do with the fact that we need to make sure, first of all, we try to split them in two different directions, if they have the disease or if they don't have the disease. If they don't have the disease, that means that they can go hopefully safely through their journey with no many interruptions. So first thing we do is we assume everybody has the disease when they come in. We give them a test. Usually it's a swab, and it comes within 24 hours. If the case cannot wait, obviously cannot wait, and we'll do it. Then what we do is we get the results. And again, depending on the result, if they do have COVID, we have separate teams that they look after the patients. So there's a team that look after COVID patients, and they go to a different floor, a different part of the hospital. They get their surgery done, and they look after during the rehabilitation, again, in a different separate area than the non-COVID patients. And they exit the hospital. They come in, they get the results, they're COVID-free, they go through a different floor, a different surgical team altogether, a different anesthetic team, different floor of rehabilitation service. So the idea is that we have learned all this, by the way, we didn't come up with this on our own. We've learned from our experience in talking and having webinars like this with colleagues of ours in other countries. So we saw what problems or what they did well in Spain and Italy, and we try to obviously avoid the problems and focus more on the successful parts that they were able to, worked well for them. And we're trying to improve of those. The whole idea is to service the community the best we can with the highest level of care and safety, while our colleagues are giving their best effort in the front line to deal with the disease. Because obviously, as an orthopedic surgeon, we don't deal directly with the disease, but at the same time, just because we have COVID, that doesn't mean that there is no road traffic accidents. That doesn't mean that people don't sprain their hands, the wrists, they don't fall off ladders, and all the rest. So that's the basic idea of what's happening. And obviously, it has a lot of implications, and it's about the everyday life of all of us working in the healthcare, but all the people around, the community, as you can see. And we try actually to encourage people to look after themselves, even when they have problems non-COVID related, because a lot of the people, what we see is that they're afraid now to go in, and that's not necessarily good. So, for example, people that have heart problems, people that have trauma, even minor, they think they can tough it out at home, and sometimes to their detriment, just because they're afraid to go to the hospital anymore. So we're trying to give this message back to the people that, they're safe, they're in good hands, and we'll look after them to the best of our ability. So it's very important to relate that message to the community and to put everybody at ease that the rest of the country and the rest of the services in the healthcare sector especially are running as they should, and obviously making space for the extra crisis. It's difficult, it's not easy, but I think we are succeeding in that because we're all coming together as a community, we're helping each other, and everybody is willing and trying to be kind and understanding of the situation. And that's what I think the message should be for you also. You should be kind to yourself, you should be kind to others at this time of crisis, and try to realize that in this time of need, when we all come together, we have the best chance of getting a successful outcome. A lot of people are under stress, the services are under stress, the people themselves are under stress, and they're reacting differently. Not everybody's reacting to the stress the same way. So we should account for that in all of our everyday dealings. And I think that's a very important message again for you to realize that when something is stressing, a stress factor is coming, and you have to deal with it, that not everybody will respond the same, and we have to be mindful of that. And that's what we're trying to do with our patients also. And we try to make sure that, they get a stress as possible free environment as we can provide from them, even by bringing our services to a different hospital, so they don't feel that they are themselves at risk when they're coming to see us. And that's basically it, for what's happening in Ireland in a nutshell. Obviously, the rest of the life, you have to realize also that we all have families. We are all human beings, and we need to let the stress to have a little bit time to ourselves, to have a time obviously for our families, for our loved ones, and we need to look after them and make sure that we don't transfer these kind of stressful situations to them. If anything, we need to make sure that we have outlets and different things that we occupy ourselves also, and that there is life outside the hospital, obviously, and make sure we give also to our community, because the problem with the COVID is not only taking place in the hospitals, as you know, it's taking place in the community. There's a lot of older people that they need our help at this moment in time, and we can do a lot of things rather than just being in a hospital, that we can help them out. The first thing and foremost that what we can do is stay at home. I'm sure you've heard the message enough times that if you don't have to be out, and if you don't have to be in the front line, you can make yourself being in the front line and as valuable by just staying at home, because that is the best possible weapon we have at this moment in time to halt the virus and stop it from spreading, so fast. Any questions that I can give you? Do you have at the moment? No burning questions? I can keep you entertained a little bit more with medical stuff, and then I will also probably would like to give you a bit of a details, or background about Ireland itself and where I'm practicing and what is going on in the area where I am, because I think that would be interesting also from you to take a little bit your mind off. Yes, Jason. Sorry.
Yeah, I think that'd be great. And, because here in Charleston, we've got different hospital systems. And then, there's been a big sea change in the last couple of decades. There's not as many rural hospitals. And so depending on where you live, you're getting a different type of healthcare experience. And then there's also a piece about healthcare insurance, which, here is typically employer provided, or if you don't have a lot of resources, it might be Medicare, sort of addressing that piece as well, if you wouldn't mind. Thank you.
Yeah, no problem. So I'll say in Ireland, we have a two-tier system, just to give you an idea. So we have a system where people can go in and they have a medical card, what we call it. And if you're of a certain age, or you work in the public system, you get this card and you can go to any, basically, even if you don't have the card, in fairness, you get injured, you get a medical problem, you walk in the public hospital and you get looked after. Now, you get looked after in a timely fashion, and you can realize that being in a public hospital, what happens is purely based on the numbers and the limited resources, that there is a queue. So you get looked after, of course, in emergencies have a priority, but otherwise you heard all about the stories that you go to a waiting room, and if you're not so critically injured, you have to wait, and the bed has come available. So that's the kind of drawback about the public. So the two-tier system comes in, where people have the ability now, while they're entitled to be treated in a public hospital, through their work, through their ability to pay for it anyway, somehow, to acquire access to private care. That means you go to a private hospital, you're covered by your insurance, or you want to pay up front. There is a charge, obviously. And then the way that works is that you have access to care again, as the resources are available there too, but they're more readily available, obviously. So you can get both, actually. and that's why we call it a two-tier system, and it's a choice of the citizen, what he wants to do or how he wants to be treated. Having said that, at the moment, because of the COVID virus crisis, the government announced as of the 30th of March that we reached an agreement with between the public and the private sector. So all the hospitals in Ireland, as of March 30th, are considered public. No patient is to be treated as private, and no patient is obviously to be billed as private. There is one system, one care. Everybody that works in the hospital will be treated as a public patient. The state is paying for them, and obviously the state is covering also the doctors to be able to work from being private and providing private care, to be able to, you know, for reasons of indemnity, for example, to be able to provide care to other patients that they couldn't before, i.e. the public patients. So that's a big and dramatic step, but a necessary step, I believe, in this moment of crisis. And I think it will work, or it's working well already for Ireland, in the sense that we have now more capacity and more ability, a bigger ability to treat a bigger number of patients, both with COVID and without COVID, because now we have a bigger numerous beds, a bigger number of beds, obviously, ventilators, physical buildings, actual hospitals, and more doctors. So I think it's a very, very good step, and we'll see, obviously, the outcome. It'll be judged by its outcome at the very end, but that shows that at the moment the country has come together, and we're all in this together to try to help the people that are most in need. In relation to the US, I'm not sure if how feasible is, you know, that's a big change for us, and it's, I have to say, easier to come about in a state or in a country where it's 5 million people. Obviously, a lot more things to be worked out when we're talking about a country the size of, you know, US. That's all, Jason, for this. Guys, am I boring you with this? No?
You're doing great.
I see some saying, no. Okay, so the other thing I was gonna give you is a little bit take off your minds about the COVID, unless you have any COVID related questions, is also that, oh, good man. Seth, you're there. I can see you now. Is to tell you that it's difficult to say that life is going on at the moment. You know yourselves what's going on in New York, what's going on. I mean, you hear it, it's in the media, it's everywhere. But we have to realize that there will be an end of it. Just try to remind yourselves of that, and that we all come out of it. We just have to make sure that as much as we can do to help our people that they're most in need. And one day we will look back into it, and we should look at it as a proud moment where we were able to offer our services to our country, to our people, you know, to our loved ones, that kind of thing. And you should be proud of it, and I'm sure we will be proud of it when we look back at it. We all have to play a role, and as I said, we're all doing our little part by doing the little piece that we're asked to do, and the result will be all together come together if each one of us does the little things. I'm sure you're into sports. I'm sure you hear about practicing. I'm sure you hear, you know, I don't know what different sports you do, but you hear it in soccer, you hear it in football, American football. I'm a big fan. I'll let you know. I'm still a Miami Dolphin fan, Jason, yeah? And just to let you know that if a player and each person does their own little bit on offense, on defense, on whatever part you need to play, that's how you come all together as a team and you see the result, which is a great team effort, right? So the same now, we all have to do our little part. You have to look inside of you and see what's asked from you or of you. Don't be thinking it's for other people or beyond you. This is a great opportunity for all of us to help. I really think that it's not only for the doctors. I know they seem to be in the front line, and they are, for, you know, the reasons that they're treating the patients that are sick. But you know, you can do a lot. You really have a lot of power by just doing the things you're asked. Can I ask, what age are you guys? Ben, Seth? The only
I'm
ones I can see at the moment.
I'm
13.
13.
Good man, good man. And Seth?
I'm 16 years old. Yes, sir.
Excellent, excellent. And tell me, what do you think about this? How do you think this is has like, I'm not sure exactly, I'll be honest with you. Each country it's at a different stage, right? So when the peak comes, it's a little bit different. As things escalate, it can be even more, become a little bit more stressful, almost scary, as you hear the news, especially, and everything. So I know New York is it's a big epicenter at the moment. I'm not exactly aware in South Carolina how bad it is, but I know the numbers there are increasing too, and I watch it, through the news myself. So what do you think? How is that affecting you? I know you're home, right? What do you think? It's upsetting. There's a lot of upset people in different ways, isn't it? Your life, the school, the life as you knew it is different for you guys.
I mean, it's all just really crazy, honestly. I mean, just with e-learning, I've never had to experience anything like this before. And just, I always like to look at the, like the new case count and mortality rates, just because I'm curious. I just want to see, I'm not like infatuated with it, but it's just like, I just want to see where this is all going. I mean, and I work at Chick-fil-A, and we haven't closed that down because it's considered an essential business, but it's weird. Everything is just different. Everything
And
is crazy.
do you find this science, now that you see the science behind this, see that there's a lot of science about doing all these numbers and crunching numbers every day and trying to do models and maths, and there's really interesting stuff. I know there's patience obviously behind it, but certainly is people that they actually never thought before. We never thought that we need them, or they were at play.
It's
Amazing.
It's like I don't think I've fully taken it in yet. Like 5 stages of grief, just deny, like, nah, this isn't happening, but it is. It's just I really don't know how to describe it. It's just weird. Everything has changed.
A bit surreal almost. And you wouldn't even, if you were to make a movie, you probably wouldn't make that up. I wouldn't, certainly, anyway. And I've seen a few movies in my life. What else I was going to tell you? That is amazing also, now that you mentioned about e-learning, right?
Mm-hmm.
I know my daughters here, I try to get them to school them myself, because we have stopped school since the 11th. Now, mind you, they're only going to the creche. So we're lucky that they haven't started proper school. But I can tell you that I thought it was a great idea myself, when we have here on national channels that they have school every day for kids to attend. You know what I mean? And my little ones were here, and I have them every week now from Monday to Friday, for an hour for their, first class, whatever they're starting, to try to learn and get engaging with this, because I think our life is going towards that. A lot of learning and a lot of businesses and a lot of education will be, conducted through this way, because we have it's the new medium we have too, right? We have access to this now. So I think you especially your generation, Ben, Seth, you better get used to this. You will be getting a lot of, in the years to come. Same with medicine too, to be delivering services and education through this kind of medium. We can talk, we can engage, we can laugh, we can learn, and we can do assignments. You see all this, and the possibilities are endless.
Yeah, I'm really thankful that I do live in this generation, in this time period, where if something like this were to happen, and it is, that we do have the means and the ability to keep in touch with our loved ones, with our families, and like we're doing now, just to, fulfill our ambition to learn. And it's amazing what you can do, even just through digital contact. It's crazy.
No, it is amazing indeed. I never thought I would see this day, to be honest, even to be talking through a camera. So it's a great testament, to all the generations, and they've been working to make this happen. And the country is the same. US is in the forefront of all this, as you know, with the technology, and they're making it happen. And out of everything, you see a bad situation. I bet you when we look back at it, I mean, there will be grief, there will be lost ones, there will be, damage, obviously, but there will also be opportunity, and new technologies are emerging. I can tell you, I've been watching myself the latest, webinars every day since this started, and I'm talking to colleagues that I never thought I would talk before, and we have come together as a community and as a people, even here in the Europe and the US, where we chat, we exchange our information, we say how we're going to help and look after our patients, and the technology that's enabling us to do all this, it's telemedicine, AI. You hear now these words that they will become everyday talk, and you can see your patients through now camera and assess a little bit. You can see wounds that the computer can tell you if a person's wound in their elbow or in their hip is getting better or worse, because they can take sequential photos, and if you put the right input, which you're looking for, let's say signs of inflammation or redness or something, the computer, the robot, kind of, the intelligence can tell you the state of the wound. So it's amazing stuff that we get to see and we get to test now because of necessity, obviously, but it's pushing us to even more develop more these technologies, and it's you guys that I think you'll be using more. Yes, Jason. Sorry. No, please, yeah.
The medical student this morning is a third year, and so they've been sidelined, and so they can't go to the hospital. But it's amazing, in 1 month, they've put together a screener. And so what they do is people call MUSC if they're not feeling well. And so these third-year med students are acting as the first line.
Oh, nice.
This online screener that he fills out, and then a primary care physician will look at it. And they've been able to create an app with Google to say, like, where in South Carolina they are, what are the chances that they might have incomplete or inaccurate information about COVID-19. But they're already seeing patterns, and I want to know if you're seeing this in Ireland or Europe, like disparities in treatment, disparities in sort of getting into the healthcare system. We're being stress tested, and what does Ireland do well, and what does Ireland can you see not doing well, or the European Union? I'd love to hear
yes
a little bit.
I'll tell you, I'll start with Ireland. Let me say that, but that's an amazing idea, and what the students are doing, actually, I have to say, it's very good and well done. We kind of had a little bit, let me make a comment about the third-year students. Our students here in the sixth med, which is the last year of medical school, because the medical school is 6 year, they had to graduate early, and they're the incoming intern year. So fair play to them for graduating early, obviously. But at the same time, there's a lot of stress for them because they're going to be thrown at the front line with, in their first year of practicing. And it's a little bit unfair, I suppose. But we try, and we have put measures in play to keep them out of harm's way, meaning to put them in jobs that they require not you to be in the front line, so they can do a bit of screening, they can be in the wards, they don't need to be, in the accident and emergency when they receive the patients. And now, what have we done well, or what the problems seem to be here? I wouldn't say there's a disparity in treatment here in Ireland. It's uniform, pretty much, I have to say. The problem is sometimes with the testing, for example, when we don't have enough reagents or enough testing kits. So then it's, basically the country has to share them. And I'll tell you, I know, for example, that we're supposed to have 12 shipments, aeroplane shipment of masks from China, and they're coming. Our budget was 12 million in a year in masks and PPE protection, protective equipment. And this year they ordered 225 worth of million, so 13 years worth. Having said that, as they arrive, they have to be distributed, and they have the disparities, if you know what I mean, in the distribution or in arriving in the more remote places in Ireland. So if Dublin gets them first, it's because of the location, purely because the airport is there. And I'm sure all the Dublin hospitals with the bigger numbers, since they have anyway 60% of the cases, will get them first. Having said that, we were not happy as in being in the west of Ireland in the time, in terms of the speed, let's say, where we would get this, protection to be able to to be available to us. It hasn't been dramatic, but that's the kind of disparities that I was aware in Ireland. In terms of treatment, people and hospitals have been very good. Everybody's following the advice, which is if you were sick initially, stay at home, don't show up in the hospital, call your GP, because here we have an organized GP system throughout, embedded in our health. So everybody has I have, I'm sick, and we'll direct them. There's an algorithm to direct you to the hospital if needs be. What also is happening, and that's a little bit of a problem, is in terms of testing, when we didn't have enough testing kits, what happens is we take blood tests, for example, so you get tested, but your result can come, I have to say, it was a bit disappointing now when we were running low in 7 days. So people had, to be stressed, with the stress of waiting to get the result for 7 days. And in the meantime, what does it mean for you to wait 7 days to get the test? In the meantime, you can get sicker and sicker, and you have to go to the hospital anyway. So what's good for the test? They're still good in doing them because it gives the people that they do this kind of business, the math of it, the models, the statisticians, a good idea how the virus is spreading, where it's spreading, and we can do the important stuff also in terms of contact tracing. So the moment somebody that has tested positive, we have dedicated teams now of people, and thank God to the volunteering work of a lot of people, like the MUSC students, that they do this contact tracing, and they're all day on the phones trying to see where is the disease spreading, what's the pattern, if there's clusters of disease, and when they identify clusters, they try to treat them. One of the biggest problems we have at the moment is having a lot of clusters in nursing homes. So they had to take, the government, extra measures to send specific teams of doctors and nurses and healthcare staff to particular areas where nursing homes are, and try to see why is it happening, or how can we stop the spread of the disease in these clusters. So it has to do with the resources mostly, I think, if any disparities have appeared. It wasn't, I'm not aware of other types of disparities in treatment per se. Can you hear me? Jason? All right. Oh, yeah.
Sorry,
maybe
someone came to my door. No, but I heard
sorry,
thank you.
I thought my internet can be slow at times too. So a few things that I would like also to mention was about, since we're talking about internet, I would like to say that I'm not one of these that believes in the theory of the 5G internet waves causing any problems. I'm sure you'll be reading a lot different theories, and I know Seth is smiling already. Probably he has read it or heard about it. Maybe that's stuff that you can look afterwards, or when the dust settles, as they say, this is the time to come together and try to be our best, rather than spreading conspiracy theories, I would say. But we can look at it when it's all over. But yeah, no disparities. The healthcare system in that, it's quite good here, I have to say. It's the two-tier system. I have to say myself, from a point of view of healthcare internationally, I think the two-tier system is one of the best systems that I have seen working, because as you know, Jason, I've worked in 4 or 5 different healthcare systems at the moment, from Canada, US, Greece, I've been in Switzerland and all this, and I know the NHS system, but the NHS system is very close here to the system we have in Ireland in terms of its public component, but we have the ability, or a much more extended, I would say, rather than bigger, private system also. And I think giving the choice to the people to see if they want to be treated either as a public or as a private, it's, I think, almost the optimal, if you're asking me. But, at the moment now, this is all off. As you know, just everybody's one country, one system, and one patient at a time. Ben, I haven't heard from you. You have to tell me at least about the Irish flag in the background.
Yeah. I got one question though.
Yeah.
It's a bit economical, but what effect do you think Brexit has had on the spread of it as well as the economical part?
Okay, so the British, because I've lived here in Ireland about 20 years now, and there is a history between Britain and Ireland, throughout. I'll tell you that they're different anyway. They're very different than the Irish, certainly, and they're different throughout history. They want to do the things their own way. So one of them was a Brexit. Believe it, that's my opinion, right? But having said that, at the moment, what they're trying, I think, to do was to take their own advice, their own healthcare staff, their own healthcare people to take their advice. And initially, what they believed in, it was the herd immunity. Do you know, have you heard the term herd immunity? I'll explain it to you for a second. So when it's, let's say we're 10 people, right? And one of us gets sick. So the other 9, if the disease is very transmissible, are very at risk to get it. If a second one becomes sick, there's 8 left, right? So and so forth. So when 7 people get sick, for the rest 3 of us to get the disease is now a little bit difficult because the 7 have gotten the disease. They're not sick. They're not making each other sick. So they really have to find the 3 of us to give us a disease. So basically what it says, the herd immunity, is that as the numbers get bigger, the disease loses its ability to spread, purely on the fact that there's very few little one of us left. To make it again a little bit more pronounced for you, is if it was 10 people left in the US without the disease and all of the US had the disease, but they cannot spread it because now they're all not sick, right? Then where are you going to find those 10 to give them the disease? So that's called herd immunity, meaning you're not getting the disease because everybody else had it. It made a cycle and now you're free of it. So basically the British wanted to, initially when the COVID came to Europe, they decided to take that route and say, maybe we should leave our people get sick. We're going to lose some, like every country, because they're going to get sick, but eventually we're going to achieve this herd immunity. And when we have herd immunity, the rest of us won't get sick. The problem is, I think they realized during that decision they made, right, that it's not exactly the right decision in this circumstance, because it's big numbers of people that you're going to lose. And you can't afford to say, oh yeah, let's lose a few people. It's human lives here, right? So the herd immunity, when you're talking about in a different setting, it can be a good thing and it can be achievable, but they realized that it wasn't achievable, and they realized it quickly, I think, quickly enough to be able to change their tactics. So then they came back into what the rest of Europe is doing, which is not following this tactic of herd immunity, and we're just trying to stop it from spreading so quickly, so fast. So we try to flatten what we call the curve by staying at home and not making each other sick. And that has to do politically now, to bring it back to your question also about the political part of it, that they were able to do that a little bit more, having the freedom of having achieved that Brexit, because they were not part of the European community. So they felt like they had more the ability to act unilaterally, meaning to act on the behalf of the country for their people on their own accord. The rest of the countries, by purely being in the union, like America has 50 states, the rest of the countries here that they're in this European Union felt that they should fall in line with the advice they get from the central body, which they have, or we have here in Europe, and we follow their advice. And by virtue of being in the EU, we all then seem to have a unison response, right? Except the people that the British, because they achieved the Brexit and they went out to try to maybe, go to a different route. I'm not sure if what's right or wrong even now, to be honest. I have an idea what I think it's right, but it doesn't mean necessarily it will come out to be right. But it seems that the way to go with the herd immunity is a little bit too risky. And you see the numbers now, because they were delayed to get their measures that the other countries took faster. Their numbers have escalated faster, and now they're seeing much more casualty and many more cases day per day. Hopefully, they're achieving a little bit of, you know, flattening the curve themselves because they took the measures, and the restrictions will have a result. It's just that they have to wait it out a little bit more, and unfortunately with more casualties. Like they're paying the price of the decision they made. Is that good enough, or did I confuse you? I hope I didn't. And tell me about any Irish connection. I see you have on the right too. There is something about the Irish, the flag. Tell me.
I've just liked them for the last 2 years. This kind of I want to live there. So, yeah.
Good man. Do you have any Irish background or anything?
Barely any.
Okay.
Yeah. So.
Well, I'll tell you, it's a very good country. You will enjoy it, and I'm sure you can make it come true if you that's what you want to do. Plenty to do. Very close ties to America, and very close ties, very close geographically also. You know, the first country you meet on your way to Europe from America. And great tradition. They're very good with the arts, the sciences, and I think you will be impressed if you were to travel here. Beautiful country, a lot of green, obviously, right? A lot of history behind it, and they are in the forefront of Europe in terms of their economy. So you'll find a job here for, I'd say, pretty much whatever you decide to do. I don't think you would have a problem. And I can assure you a great culture. People that they're very open-hearted, very family-oriented, nice to each other, and care about their community. You know, so a strong sense of community here, like in South Carolina, and they're willing to help and stick. You know, give their hand to their neighbor. So you made a good choice, I think. and I hope you can follow up with that. If at any point you ever need anything I can help you with, you can talk to Jason and he can get in contact with me. And if you want to visit, you know, we'll be happy to have you over. We'll make sure you have a nice experience anytime you decide to make a trip.
Perfect.
Good man. And just keep in mind yourself, like Seth said earlier, that this e-learning and you know, the having services over the internet or your education over the internet might be, you know, something that all you guys have to get used to slowly. And I know, you know, I don't know if it's the optimal or non-optimal, but it might be a way forward for you for the foreseeable future anyway. And there's a lot of stuff you can do, as you can tell, that you know, without having to go to school physically, and keep yourselves active and involved, and still make a difference, right? Good. I'm glad. Anything else? Jason,
I think there's some other questions out there, Nick.
Hi,
Celeste. Hi, Celeste.
Hi. I really enjoyed your talk. Your spirit is really wonderful, by the way. I just wanted to mention.
Thank you very much. You're very good.
We had the pleasure of speaking with Jason's brother from Kuwait a couple of days ago, and I was wondering, he talked about the difficulty in finding onions in Kuwait. I was wondering what is hard to find in your area.
Okay. Did you say difficulty finding, what was it?
Onions.
Onions. Okay, so food supply. Okay, so I'll tell you what we do here. In Ireland, as you know, we have our main products, a lot of dairy, we have endless green, and a lot of water. So we're good with that. But I'll tell you my experiences. I order myself, you know, online, and I try to not go in and have our delivery here once a week or maybe every so often. And I haven't heard of any problems in the food supply. But despite that, and despite the reassurances, I can tell you that 2 weeks in a row I tried to get flour. There's no flour. that they had delivered to us. That doesn't mean it doesn't exist, because I was told from some colleagues of mine that I asked casually, and they told me that they went to a different store and they went in and there was flour. But the sense that we're all getting as a community, and I'm sure because it's not a food problem per se, or it wasn't a flood or an earthquake or something that created the inability to have to break the food supply chain, is that there is not a problem yet. There might be a problem in the future. I do not know. I was reading actually an article, I'll tell you, interesting today, that it was saying that most of the economists make all these predictions because it's based on having a three-month food supply or a business ability to survive economically. So after, if that were to last in such hard a way, meaning having a lot of restrictions for more than 3 months, could it come into play, and should we be worried? I don't know. I know people saying also they couldn't find, toilet paper. I never experienced this, and I know people were buying loads of it. But having said that, I have not. We didn't have a problem. We don't have it. We don't see that problem here. I'll tell you also what I read about. Funny enough, about the toilet paper on a paper yesterday again online, is that the two major companies that supply paper in Europe, which I didn't know, that's all news to me, but I'm learning myself every day. They're coming from Finland, and they were explaining that the problems they had to face in the future would be people and a lot of trucks that they deliver getting halted on the different countries at the borders, because they have endless lines now between the checks and people, queuing to go through, that could delay an order, but not that they didn't have enough of it. So I couldn't comment obviously about Kuwait. I haven't heard anything, but certainly here at the moment, we don't seem to have a problem. Like, I don't sense that people have any issues with that, or it has been a problem. And if people do need onions, maybe we start thinking of ways of exchanging goods between ourselves in the community. Go back in the old ways where, whatever I have plenty, I can give to you that you're lacking, and then you can give me something of what you have plenty.
Good idea.
Okay. I see also Celeste, but I don't see Celeste anymore. She was online also, yeah? Celeste? All right.
I'm still here.
All right, good. Just making sure you're okay. I hope you enjoyed the talk, and we get you in Ireland too. I have to make an invitation. I have to make an invitation now for Celeste, Ben, and Seth. Well, the names I can see anyway. But they have to visit Ireland at some point.
Happily.
And I was planning to come to South Carolina to see you guys. I went to College of Charleston. I'm a College of Charleston graduate. I won't say what year now. We don't need to mention years, but I was planning to visit here early in the summer, but I'm not sure now how this is going to play out, especially with the airlines and the restrictions. But we'll see. Definitely, though, I'll make sure. I was dying to see Jason and Tasha, obviously, and the family, but we might have to hold off on that for a little bit longer till we finish with this unprecedented times we're going through, and when we get some normality, the sooner the better.
You can all see that Nick is a very warm spirit, and we've got him for a few more minutes. So here's your chance to throw any questions at him, because he'll answer them. Yeah,
Seth, tell me.
I just had a question. Going back to the treatment of patients, I was just curious about, are you guys prioritizing individuals of a certain age or who have an underlying complication that might just everyone get the same treatment? It's just, I'm a diabetic, and, seeing that article, it's like, oh, the top 4 risk factors that in case you get coronavirus. And I was just, oh, boy. But
very, very good questions, Seth. I can assure you that we're not doing anything different than what we were doing before.
Mm-hmm.
I know there is a little bit of hype in the media, and it seems unreasonable and inhumane almost to be treating people in a different way. human life and human, yourself have the same value for everybody. We're not ageist. We're not trying to separate people. At the same time, there is a reality when you have, especially a certain number of resources, finite resources. So I will take you out of the scenario of COVID, and I will take you, I'll give you an example before that, before ever COVID came to us. When you have somebody that's really sick and he has to go to a ventilator, right? There is a certain, it's not a simple procedure. And we know that independent of the disease process that's going on and what made you go to require a ventilator, could it be a road traffic accident that you were going 100 miles per hour and you had a nasty accident? Could it be that you had a chest infection? Could it be that you had the renal, your kidneys were failing? For any reason, when you go to an ICU setting, unfortunately, age plays a role on the outcome. Meaning, independent of the reason you go in, the older you get, the poorest is the outcome for you in terms of even getting off the ventilator. That's why now this arises, because before the COVID, especially when we have finite resources, and in a country, for example, of Ireland, where it's 500 ICU beds, intensive care unit beds, when we get, for example, and I'll say a number just to give you an idea, is that when you get somebody that's 90-year-old and has many comorbidities, meaning they had a bad heart a little bit, they have a bad kidneys a little bit, and not everything is optimally functioning, we know that they're going to have a very poor chance of coming off the ventilator. So we're trying to explain to the family that even if we know that they have a very poor chance of getting off the ventilator in the range of 10%, and then a quality of life that's not even up to that level of 10%, then we tell the family these facts. And most of the families, they realize that that's not a good way for their loved one to go, to put them in a ventilator, to have a 10% chance of coming off of it, and then with a bad quality of life. So they come to terms with it. They say their goodbyes if they need to. They make a decision altogether. We know the directives from the patients before. There's a lot of ethics come into it. We assure the family that we'll look after them in the ward. They don't have, it doesn't mean that because they don't get on the ventilator, they don't get all the supportive measures that we would give another patient. And, to keep them pain-free, to keep them with a good quality of life, or whatever is left of it. And then there is a decision made not to go to the ventilator if they don't need to. It's not that we just leave them because they're 90 and we don't like them and we'll say they don't need to go to the ventilator. That way now the resource becomes available for a patient that has a higher chance of getting off the ventilator. And that happens to be the younger person, we know that from the statistics, and the person that has no comorbidities. So they have a better chance of coming off the ventilator with a reasonable quality of life. That's why then you hear now all this about the COVID, because if you put now this in the perspective of a crisis, and it's a disease that affects the elderly purely because the elderly have a poorer lung function by the age of 80 and 90, or they have other comorbidities. So it happens on its own almost. It's not that we make it happen and say to people, oh, you're 90, we're not going to put you on a ventilator. And unfortunately, sometimes when it becomes so critical that there is only 2 beds and there is 10 people, somebody has to make tough decisions. It's not per se, again, they're not only based on age. There's a lot of science, what I'm trying to tell you, behind it, and usually has to do with statistics and experience. What the experience will tell you gives you the best survival. These are not decisions that we take lightly, and this is not a decision that anybody wants to make, I promise you. I don't think in Ireland, obviously, I know that we're not making them when we're not in that level. I am aware, and okay, from the media again, that some of these decisions sometimes have to be taken when there's a death total of so much that overcomes the ability of the system. And that's part of why we say it's so important to stay home. So the system won't be overwhelmed and will not have to make for you, I mean, for every citizen, that's what I'm saying, for you, that decision. But again, when we make the decision, I want you to know that it's not based on age just to be ageist. Age is one of the parameters along with the comorbidities that we measure to see who has the ability to use the resources to its best to get a good result out of it. But it doesn't make anybody happy to do this. You know, and it's unfortunate when it comes to this. It's unfortunate, but no system has endless, you know, resources. Doesn't matter even if it's a private system. Things can become overwhelmed, and that's the idea, not to let them go to that point. But very excellent question, and I'm glad you asked. Actually, it's not an easy one, but.
Yeah, I was just curious, you know, just the fact that my a weakened immune system, it's like kind of worries me, but I don't like to panic. I feel like that's the worst thing you can do.
But panic doesn't help anybody, as you know, and you're doing the right thing. You should not be panicking and thinking about the things. As I said, everybody do their little part, and it's not little. That's what I'm trying to say. You do your part and you stick with it, and only good things will come out of it.
Every single person on the planet contributes to how this is all going to end up. So I don't like to freak out about it. Of course, I get it and the risks, but I play my part. I stay home and do what I must.
Exactly. That's the way to go. Well done. And I'm glad you're saying that. We couldn't be asking more for anybody. You know.
Thank you.
Good. I think we have come to an end. Ella, tell me.
Yeah, anyone got another one? We're wrapping up our time.
By the way, I want to thank everybody. I'm very happy that I met you, and I can only hope that I can see you again on the other end, and we'll all celebrate together, be it in South Carolina or be it in Ireland. Jason.
Yeah, you know, your warm spirit, even though you're, you know, over 1,000 miles away, clearly came through, and enjoy you sharing your time with all of us today. And like Nick said, if anyone wants to get in touch with him, just let me know, and I'll connect you all. Celeste, did you have a question before we went?
No, I just wanted to say thank you.
Okay.
Really wonderful.
Well,
thank you guys.
Thanks
Keep
to everybody.
Up the spirits.
Yep, Nick, please take care, be safe. Say to Amy and the kids. And everyone else, have a great evening.
Same to you, Jason. Amy's waving there. Have a good afternoon. Actually, what is it? 5, and a good evening. And it's been a pleasure. Anytime I can help. Bye-bye.